28 million Americans are uninsured, according to the U.S. Census Bureau, and the Lone Star State holds the title with the most amount of people that are currently not paying for coverage.
And 4.5 million people who are uninsured in the state of Texas. So that's going to translate to about 16% of all people in Brownsville, as well as across the state of Texas.
Jan Duboscus, who just heard from, says it has become unaffordable for Texans to get coverage, but new proposed federal rules which aim to alleviate this issue will allow short-term health care to be offered for up to 364 days, giving residents the opportunity to have coverage for longer periods of time. Now, whether you have insurance or not, one thing is for certain: preparing for an unexpected health incident is key to your livelihood. The Centers for Disease Control and Prevention says strokes are the 5th leading cause of death in the U.S. That's why raising awareness is fundamental. Here to tell us more is Dr. Amir Hassan, who joins us today, and I have the pleasure of finally meeting you.
Nice to meet you as well. How's everything going?
Everything is great. Dr. Hassan, thank you for joining us. Important information. I mean, stroke awareness, right? It's like an ongoing situation that we continue to tell the public. It's always fundamental. Yes,
the most important thing is that stroke is treatable. And I think if more patients knew that if they came into the emergency room fast, we would be able to treat them, whether it's IV medication or taking a catheter up and going into their brain and pulling the clot out. So the first thing is all education and awareness. That's what we're really trying to focus on this year.
Yeah, and certainly we want to talk about what some of those symptoms are, because sometimes people think I'm vomiting, I don't feel very well, and they think it's just kind of your common day illness or disease, but really, what is it that people should really look out for?
So the BFAST acronym was created by the American Heart Association, and B is for balance. So if you have any balance issues, any trouble with your eyes, double or blurry vision, if you have face weakness, arm or leg weakness, slurred speech, it's time to call 911.
Yeah, definitely don't wait until it's too late, and then it might certainly cause a fatality.
Yes, so stroke is now the #5 killer in the United States. Used to be the #3 killer just a few years ago. So with the advent of all this research and all these new devices coming out, we've been able to keep people alive, and we're trying to improve their outcomes. It's still the #1 cause of disability, and that's what we're trying to work on.
Definitely. We do have an event coming up that we want to talk about. We do have the graphic on the screen right now. Tell us about the Red Ball.
So this is going to be the 4th Red Ball. We always time it with our education symposium that's on the island. And the idea is we're raising funds. We team up with the American Heart Association, Valley Baptist. There's a new local foundation called the Stroke Research and Education Foundation. And the goal is to advertise stroke education. We're working on putting fast billboards, PSAs in Spanish and English on radio, TV, and just getting the word out there. And the more people we educate, the more people will be able to help.
Dr. Hassan, before we go, if you can give us really quickly some numbers as to what you see, at least here or at Valley Baptist Hospital.
So there are actually about 2,000 strokes a year in the Valley. About 700 of them, 800 of them are admitted to Valley Baptist, and we're only treating about 120, 130 of them. So the goal would be to treat at least 30% of that 2,000 patients.
And that is the goal. Dr. Hassan, thank you again for your time.
My pleasure.
Valuable information this afternoon.